Excelsior. What's up, Excelsior? How y'all doing? My name is Sylvester Lee Williams II, and I am a licensed psychiatric technician or an LPT. I've been working as a licensed psychiatric technician for over 8 years for the state of California in various departments, and we'll talk about that a little bit later. We move forward in this presentation and we talk about the places that I work as an LPT and what I do as an LPT. I want to just give you guys a little fun fact. And that fun fact is I am the proud father of 4 amazing kids sitting right there amongst you all. Yes, Emily, Dylan, Aiden, and Kaylee Williams. Those 4 children have motivated me to excel in my career and help others as a licensed psychiatric technician. Now, without further ado, I would like to get into the places that I have worked. Let's start from the top. California Department of Correction, CCI, Tehachapi Prison in Tehachapi, California. Now, Tehachapi, California is south of Bakersfield and north of Lancaster, California, north of Los Angeles, California. I've also worked at CSP LAC, Lancaster Prison in Lancaster, California. We'll talk about a little bit more in detail or in depth about what each of these places entail and the type of work activities and day-to-day schedules and things like that they involve. I work for California Department of Developmental Disabilities and Rehabilitation Services at Porterville Development Center in Porterville, California, which is north of Bakersfield, south of Fresno, California. I worked at Canyon Springs Development Center in Cathedral City, California, which is east of Los Angeles, east of San Bernardino, east of Rubidoux. It is east of Palm Springs, west of Indio, California, if those of you familiar with the city of Cathedral City. I work for California Department of State Hospital, DSH Metropolitan State Hospital, aka Metro Hospital in Norwalk, California, which is west of Pomona, California, east of Los Angeles, California. I've also worked at DSH Patton State Hospital in Patton, California, which is actually east of San Bernardino and it's in the city of Highland, but Patton is so large, it's so big that the city of San Bernardino gave them their own zip code and rendered its own city. I also worked at San Bernardino County Department of Mental Health. I worked at Los Angeles County Department of Mental Health and a handful of private sectors, Elwyn, People's Care, and so much more as a licensed psychiatric technician. Now, as you can see, there is no shortages on job working as a licensed psychiatric technician. What is a psychiatric technician? A psychiatric technician are mental health employees who provide hands-on care to people with varying degrees of mental illnesses and developmental disabilities. We perform a vital frontline function in all of healthcare settings as we observe, we treat and interact with the patients that we serve, often more than any other staff within the facility. We are the first line of contact throughout the entire process from intake of termination of services. We carry out doctor's orders, serving as the eyes, serving as the ears and the hands of the diagnosing professionals like psychiatrists and psychologists. We report back on how the treatment is working and we report any unusual symptoms that may need professional attention from the doctor that may cause harm to the client. And at the entry level, which is a non-licensed psychiatric technician, they help patients with personal grooming and other activities of daily living, such as feeding, bathing, etc. They also help conduct educational, recreational, and therapeutic activity. This level is called a psychiatric technician assistant or a psychiatric aide. Now, at higher levels, which is your licensed psychiatric technician, they have more formal training than the psychiatric aides. They take part in both the planning and implementing of patient treatment plans, and they may be responsible for admitting and interviewing patients, record keeping, administering medication, or assisting it, and also conducting therapy group sessions. Exciting, huh? Very exciting. But at all levels, psychiatric technicians need good observation skills. It's important for psychiatric technicians to have great personal character that includes a stable personality, an ability to work well with people, and a true motivation to help others beyond the call of duty. Now, depending on the needs and preferences of the employer, a psychiatric technician performs in one or more of the following areas, and I'm going to get to that right now, as you can see on the screen. Patient assessment, therapeutic activities, treatment plan development, basic and advanced nursing, medication administration, documentation, addictive disorder treatment, treatment plan implementation, group process, aka group therapy session, treatment evaluation, patient and family education, and geriatric care for the older population, which would be our senior citizens. Now let's get more in detail about what we just discussed and what we just talked about as far as a psychiatric technician, depending on the environment they work in. Now, some of the skills and duties of a psychiatric technician: to care for mentally impaired or emotionally disturbed individuals, following physician's instruction and hospital procedure. We help patients with their personal hygiene, such as bathing and keeping beds, clothing, and living areas clean. We assist in observing patients to detect behavior patterns and report observations to medical staff. We intervene to restrain violent or potentially violent or suicidal patients by verbal or physical means as required. We administer oral medication and hypodermic injection following physician's prescriptions and hospital protocols or procedures. We issue medication from dispensaries and maintain records in accordance with specified procedures. We contact the patient's relatives by telephone to arrange family conferences, and we also take and record measures of patient's general physical conditions, such as their pulse, temperature, and respiration, to provide daily information, also known as vitals. We lead, prescribe individuals or group therapy sessions as part of specific therapeutic procedure according to the doctor's orders or the nursing care plan. And we complete initial admittance form for new patient, which is intake, where we do mental status exam, diagnosis, or mental illness. I know what you're thinking, Mr. Williams, when are we going to get into all the fun stuff? Now we're going to get into all the fun stuff. Now let's start talking about the work environment. The work environment of a psychiatric technician generally would include a 40-hour work schedule, with lots of overtime, because patients and clients need care 24 hours around the clock. We have scheduled work hours that may include working overnight, weekends, and holidays. And that depends on the facilities and the department need. We spend a lot of time on our feet, especially if you work in the AM shift, partially on your feet if you work in the second shift. And overnight, I'm not even going to let the cat out of the bag. We won't even talk about the secrets of overnight. Now, there are some times where, as a psych tech, you're working on a unit and you're confronted with violent patients who must be restrained. And this may be emotionally draining, but we must also gain satisfaction from assisting the needs of others. Because I'll just be quite honest with you. You could be working on a unit and you may resemble someone who used to bully or abuse one of the clients. That may trigger them. That may trigger some psychosis inside of them that may cause them to be focused. And we'll talk about some of the things you can do. But once a client is focused on you, then you have to inform your supervisor of that immediately. Inform your coworkers of that immediately so that you can be removed from the area where you are triggering the client. Now, I know this is the part you guys have been waiting on. How do I become a psychiatric technician? Now, to become a psychiatric technician, you need to complete a psychiatric technician program, which usually takes about 12 to 18 months. Now, up north, they have a Questel College across from a Tuscadero State Hospital, which is another state facility, who allows you to become a psych tech in 9 months. So you go to school. After 6 months of classroom, you'll go across the street and you do your clinicals at the hospital, where you actually have a paid internship to work as a pre-licensed psychiatric technician. And then after you complete your 9-month program, you're able to sit and test for the board, where you could become an actual licensed psychiatric technician. Now, the program's available at community colleges like the one I attended, which is Mount San Antonio College, aka Mount SAC, which is widely considered the Harvard or Spelman of psychiatric technician program. If you went and did your psychiatric technician program at Mount San Antonio College, everybody's hired. Everybody's hired. Now, let's talk about license. After graduation, you take the California licensing exam to become an LPT. But prior to this, you could actually get hired with the state as a pre-license. Now, as a pre-license, you won't be able to administer medication, and they will only hire you temporarily or seasonally for 9 months. You can only work 9 months as a pre-license. After that 9 months, you have to get licensed. And you figure after working for 9 months of experience, you should be able to sit down and take the boards because the boards are very practical and it's based on real life experience. And people like myself who work as psychiatric technicians are the people who put the exams together, assist the governing board with determining what's going to be weighed on the exam. Now, once you are a licensed LPT, you can work in hospitals, mental health facilities, or correctional settings. You could also continue your education to become a registered nurse or occupational therapist or even just a regular therapist. Now, I want to talk about why is this career rewarding. My personal story. One of the most rewarding parts of my job is seeing patients improve over time. For example, give you an example. I have worked with a patient who have came to patent severely withdrawn from all of their peers, their family, everyone, from themselves. And through consistent treatment and care and support, this client had eventually started to engage in the therapy and they had found hope to thrive on their own again. Now, let's talk about the community impact. Now, our work not only helps individuals recover, but it also contributes to the public safety by addressing the root causes of mental health crisis. I'm sorry. Now, there are a lot of misunderstandings about mental illness. Would you agree? But as a psychiatric technician, I work to break down the stigmas and I work to show that recovery is not only possible, but it is attainable through consistent methods of treatment. If you're interested in helping others and working in a career that's challenging and allows you to grow every day, this could be a great fit for you. Mental health is such an important field, and there's a growing need for compassionate professionals to become psychiatric technicians, such as yourself. Now, because I wasn't there and I didn't give you guys a chance to ask me any questions, I have come up with some questions right here in front of us. As you can see, I'm going to answer them for you guys. I'm going to ask them out loud. I'm going to answer. All right. Question number 1. What is the most difficult part of my job? The most challenging part of my job is managing crisis when the inmates or the patients are experiencing severe emotional or behavior episodes or triggers is what we call them. Now, these situations are difficult because they're unpredictable and they require quick thinking, patience, and teamwork to de-escalate the situation safely. Now, it's emotionally taxing at times, especially when you see someone struggling deeply, but knowing we're helping them work towards stability makes it just all worth the while. It makes it all worth. Now, that's why it's important that when you are on these facilities for the first time to read the charts. If you have downtime, read the charts so that way you'll be able to predict the behaviors of the clients that you're going to be working with. Let's move forward to number 2 so we won't keep up much of your time. Now, what's the salary range for an LPT? The salary range for a licensed psychiatric technician typically ranges from $50,000 annually to $80,000 annually within your first year. And that's not including any overtime or bonuses. Now, the exact amount, it depends on your level of experience and the location. For example, working at a state hospital like Patton State, it often comes with additional benefits and opportunities for overtime, which can increase your earnings. Now, the highest pay is working at Department of Corrections, where they pay you two times the amount to work in those facilities. And there's some other incentives that come with working in prison. The prisons, they give you a safety stipend. That's amazing, isn't it? Now, I will give you a hint. My first year as a licensed psychiatric technician, I made $111,000. And I don't like it, so it wasn't much of it. Now, let's move forward to number 3. How do you stay safe working with patients? Safety is a top priority in my working environment, especially for myself because I want to make it back home to my kids. Now, we receive extensive training in crisis prevention and intervention techniques to handle these difficult situations. CPI trainings and such. Now, we also use a team approach, so we're never alone in high-risk situations. And additionally, we will build rapport with the clients, to establish trust, which helps minimize conflict and get familiar with one another. Now, the hospital has a safety protocol in place, just as well as the prison and a DDS facility, like secure units, monitoring systems, and all of this is to ensure both patients and staff are protected. Now, we all wear our alarms. Now, if you fall and you land supine or parallel to the floor, your alarm will go off. If a client pull at your alarm, it'll go off, or if you pull your own alarm, it'll go off. And once that happens, all of your co-workers and hospital police or Department of Corrections, everyone will pop in and protect. Now, that's going to conclude my presentation today. Thank you all so much. I hope you guys have learned some valuable insight as to what a psychiatric technician is and how to become a licensed psychiatric technician. Thank you all for having me. Thank you to the faculty, of course, the students as well. And this concludes. Again, I'm Sylvester Lee Williams II, your licensed psychiatric technician. Have a great day.